Welcome to this webinar. We're just going to wait a few moments while people join, and we'll start the webinar properly in a minute. So, hello and welcome to this webinar, Tackling Health Inequalities Through Green and Blue Infrastructure, which is brought to you by the University of Exeter and the TCPA on behalf of the Green Infrastructure Partnership. I'm Julia Thrift, Director of Healthier Placemaking at the TCPA, and I'm your chair for the webinar. A few years ago, I came across research suggesting that good quality parks and green spaces can help reduce health inequalities in local populations. This really intrigued me. Reducing health inequalities is something that most governments are very keen to do, and here it seems is a relatively simple way of helping to achieve this. I was keen to learn more, so when Professor Ben Wheeler said that he was going to do more research into this topic, the TCPA was really keen to lend its support. So I'm delighted that today we can hear from Professor Wheeler, his colleague, Dr. Mark Ferguson, and then have a case study from Rupert Lloyd and Amy Smith of Dorset Council. We'll hear the presentations first and then take questions at the end. So please can you put your questions in the Q&A box, which is at the bottom of your screen. You're really welcome to post comments and introductions in the chat. Feel free to do this. But if you want to ask a question to the panel, please put the question in the Q&A box because that's what we'll look at the end to take the questions. And finally, this webinar is being recorded, and the recording and the slides will be available on the project website that Professor Wheeler's put together, and there'll be a link at the end of the presentation. So I'm now going to hand over to Professor Wheeler to introduce green spaces and health inequalities. So welcome, Ben, and over to you.
Thanks so much, Julia, and thanks everybody for joining us here. Really great to have you all with us for this webinar. So as Julia says, we're going to be talking broadly around green-blue infrastructure and health inequalities. And we've got kind of three sections to these talks to kick us off, and then hopefully lots of time for Q&A and discussion afterwards. So I'll start things off just by a general introduction to the ideas around how we consider green and blue infrastructure and health inequalities to be connected. So next slide, please. So how are these things related to each other? Next slide. So many of you working in these kinds of fields will be familiar with the ideas of inequalities. Here we're looking at health inequalities across England. So this is data on healthy life expectancy at birth, so a kind of measure of the length of somebody's life we might expect them to live in kind of good health. And so this is national data divided up into socioeconomic deprivation deciles. So from the most deprived 10% of the country to the least deprived. And if you're familiar at all with these kinds of data or these kind of circumstances, you won't be surprised to see the kind of gap that we see here. So around a 20-year gap in healthy life expectancy across deciles of socioeconomic deprivation. And across the last, well, certainly the last decade, the gap really didn't change very much at all. That gap staying fairly consistent. So this kind of intractable challenge of social health inequalities has been with us for a long time, and it's a big challenge for us societally. Next slide, please. Here we see the same kind of data. In this case, the previous slide was male healthy life expectancy. Here we have female healthy life expectancy. This time on a map. I'm a geographer, so I love to put things on a map. And here we can see how that healthy life expectancy distributes across the UK. And if you're familiar at all with the social geography of the UK, this kind of pattern won't be surprising at all to you. Typically, we see sort of poorer health and well-being in the post-industrial areas of Northern and Midlands of England, in South Wales, parts of Scotland and Northern Ireland, but also some real areas of really good health and population health and well-being elsewhere. But of course, these kind of broad brush inequalities hide much finer scale inequalities. So if we go to the next slide, please, we can see these kinds of inequalities arising at all scales. So here, just within the City of London, this is from a study carried out by Danny Dorling at the University of Oxford now, on the stops of the Central Line, and basically comparing the neighbourhoods around the 32 stops across the Central Line, which runs roughly from east to west London. And you can see here, even with a very short distance within a city like London, you have these huge inequalities in health outcomes. In this case, life expectancy, and we can see pretty much a 10-year gap in life expectancy between those neighbourhoods around certain stops on the Central Line and other neighbourhoods, and really quite significant variability between really adjacent neighbourhoods. Next slide, please. So what are the drivers of these geographical health inequalities? Well, really, it's a whole ton of things that are all interconnected. This is a really nice model of the drivers of health geographies. And it includes everything from our individual characteristics, our age and our sex, and other sort of our genetic factors. But we operate as individuals within our families, within communities, within our neighbourhoods, our local economic circumstances, how easy is it to get a good job, how easy is it to get good housing, and so on. And then that all situates in the bit that we're interested in today, particularly the natural environment. So we're thinking about aspects of the natural environment that might relate to health and well-being. And of course, that all situates within a much wider global system, our global ecosystems, for example, of climate and biodiversity, but also our global economics, our global political circumstances. And so perhaps when we add all these things up together, it's really unsurprising that we see within the UK or within parts of the UK, the degree of health inequalities that we do. So then the question is, well, okay, what might we do about it? And that's where we'll get to in the second part of this presentation. But here, next slide, please. We can think about how might it be that natural environments, and specifically here, I'm talking about green and blue infrastructure. So perhaps taking us beyond our conceptualizations of neighborhood nature being all about parks or beaches or footpaths and so on, to all the aspects of green and blue infrastructure, whether that's trees in streets, whether it's green roofs and green walls, planters in built up areas, all the different aspects of green and blue infrastructure that we find in our neighborhoods and in our living environments. We've got lots of different evidence that's accumulated. I mean, people have been thinking about this for thousands of years, but really in the last 20 years or so, we've seen a real escalation in the volume and quality of evidence telling us about how natural environments can be beneficial for population health and well-being. And these have been sort of categorized, if you like. There's lots and lots of different mechanisms, but they've been usefully categorized, I think, into these three main areas. So one area of restoration. So we might think about things like stress recovery. You know, how can exposure to natural environments help us deal with the stresses and strains of everyday life, whatever our living circumstances are? There are also lots of psychological processes going on. So attention is something that's been studied a lot in environmental psychology. Some of you might be familiar with attention restoration theory. So these ideas around how exposure to nature might help to restore our powers of concentration, our cognitive capabilities. Then building capabilities is another of these three main areas. And perhaps some of the more obvious things that we might think about, say when we look at parks and how they might support good health, physical activity is one. And we know that physical activity has a huge impact on population health and well-being. And perhaps natural environments can support and encourage that physical activity. Also providing opportunities for social contact, perhaps supporting community social cohesion by providing those opportunities for neighbours, for families, for friends to engage with each other. Perhaps something we saw most exemplified during the pandemic, and where I think people really recognised the opportunity that's presented by natural outdoor spaces as places for social connection. And then thirdly, it's also about harm reduction, so perhaps protection from other environmental hazards. And we know that green and blue infrastructure, especially in our cities and built up areas, can help to mitigate the impacts of air pollution, can help to mitigate excessive heat, and that becoming increasingly important as our climate changes. So lots of different ways in which green and blue infrastructure might benefit our health and well-being. So how do we tie together these ideas of green and blue infrastructure and health and social health inequalities? The next slide, please. We know that there are significant environmental inequalities across lots of different domains. So if we look at air pollution, we know that it's typically our most socioeconomically deprived parts of our cities have the worst air pollution, and lots of other characteristics too. And in this case, we're looking at European data about people's perception of how difficult it is to access recreational or green areas. And in every nation, we see this differential in how easy people find it to access recreational or green areas by income. It's really variable, so it really varies between countries in terms of that perceived difficulty. But within countries, we see that really varying as well, according to income. And typically, we see a pattern where those in the lowest income groups perceive the highest difficulty of that access, but it's not the same in all countries. So we do see some variability, but certainly when we look at the data for the UK, that's the pattern that we see repeated here. So we have these environmental inequalities relating to our green and blue infrastructure. Next slide, please. This all builds on earlier work, and I'm not going to get into this in great detail, but there's a whole world of work on environmental justice. This really started out, certainly in terms of the world that I work in the US civil rights movement in the 1970s, where it was really clear that the most hazardous environments were really unequally distributed, especially across racial and ethnic groups in the US. And it's really important when we're thinking about environmental justice that we consider these three different aspects of justice. And again, not time to go into these in detail in this webinar, but we think about distributional justice. How is our green and blue infrastructure distributed? Who gets to benefit? But other aspects of justice are important as well. Procedural justice. Are the processes that deliver the benefits of green and blue infrastructure equitable? And recognitional justice. Who's at the table in decision making? Who is recognised as experiencing inequity? And in a lot of this project, we're actually really just focusing on the first piece, on distributional justice, but we have to recognise as that being underpinned by procedural and recognitional injustices. Next slide, please. So three main ways in which I'm going to talk about inequalities in green and blue infrastructure and health being connected. So lots of studies indicate that there's unequal access to nature. We've already seen that European data to indicate that. But it's not always that straightforward. Some studies indicate the exact opposite, that there's actually better geographical accessibility among lower socioeconomic groups. So it's probably really important here that we consider not just how much green and blue there is around us, but what's its quality, how is it used? We're concerned with what's there, not just anything being there. So probably we need people to have access to good quality, safe, biodiverse green spaces and blue spaces. Next slide, please. We've seen this in data, so a study from a little while ago now in Bristol, analysis of their city quality of life survey found that respondents in more deprived areas lived closer to green spaces, but reported poorer perceived accessibility, poorer safety, and less frequent use. So really starting to get into these complexities of it's not just what you live near, it's what's the characteristics of it. Next slide, please. More recently, people have done some work looking at parks across Great Britain using the Ordnance Survey Green Space Map and other data resources as well. And they use that data to group green spaces and open spaces, parks, by functions, and then looked at how they're distributed across the country. And interestingly, they found, for example, that there was a higher proportion of sports-focused parks in more deprived areas of cities and areas, but actually a lower proportion of amenity-focused parks and biodiversity parks as they classified them in more deprived areas. So we start to see this differential, this real need to tease out the characteristics of our green and blue infrastructure and how it's distributed. Next slide. What about actually visiting nature? Not just kind of what you live near, but what do you actually go and do? We're really lucky. We've got brilliant data here from the Natural England Monitor of Engagement with the Natural Environment. Now this has become the People and Nature Survey, huge national survey looking at people's engagement with nature, where they go, who they go with, how their experience is. And perhaps, again, unsurprisingly, we find that those people who reported being infrequent visitors to nature, so visiting once or less per month, were more likely to be female, to be older, to already be in poor health, to be in lower socioeconomic groups, to come from an ethnic minority, to live in a relatively deprived area, and also to live in areas with less neighbourhood green space. So there's a lot going on here in terms of the characteristics of folks who perhaps find it more challenging to get that opportunity to access nature. Next slide. And it's really important as well that we look at, what are the actual barriers? And really interestingly, and this is really interesting for me, coming at this from a geographical kind of environmental infrastructure point of view, actually a lot of the main reasons people give for not visiting nature more are not necessarily to do with the environment that's around them, but to do with things like not having enough time, just being too busy at work or at home, or being in poor health, or things like just not being interested. And of course, that's something that we have to allow for here, that we can't afford to be too evangelical about the opportunities nature presents for health and well-being. For lots of people, it's just not something they're interested in, and they'd much rather spend their time doing other things. And of course, that has to be absolutely fine. Next slide, please. We were able to get into this a little bit more in some work with the Scottish Government, looking specifically at inequalities in access to blue coastal space in Scotland. And really interestingly, that work, which included both quantitative and qualitative research, found that there were lots of perceived benefits of visits to the coast, even amongst people who didn't actually make those visits. So I think lots of people who even weren't visiting perceived there to be benefits for themselves of visiting the coast. But they reported similar kinds of barriers and some others as well. So some of them motivational, actually some of them like that, just not being interested or not having the motivation to go, but lots of other really important things like costs and travel barriers, antisocial behaviour in those environments, the availability of facilities. And then these broader ideas around social and cultural norms. Is it okay for somebody like me to be in this environment? And then people facing stigmatization and discrimination in those environments. So there's an awful lot going on here in terms of how our natural environments are more or less available to people in order to enjoy the benefits of them. Next slide, please. So what about the flip side? What about the opportunities presented by natural environments? Well, really interestingly, it's been proposed that there is this idea of equigenesis, the creation of equality, with some studies indicating a disproportionate health benefit of access to or exposure to natural environments for people in lower socioeconomic groups. So there's a really interesting question here in that, is it possible that good quality living environments, such as those with high quality green and blue infrastructure, are able to somehow mitigate to some extent, the damaging effects of socioeconomic deprivation? So that's the equigenesis hypothesis. Next slide, please. And we do have some data on this. This is just one example. This is one of the earlier pieces of work looking at this, studying mortality in this case across England, and finding that, yes, people living in greener urban areas typically experience lower mortality rates, but also crucially that socioeconomic gradient in mortality was actually weaker in greener areas. So the differential in mortality between our highest and lowest income areas was actually lower in the most green areas of the country. So really interesting to start to see some sort of empirical evidence of this idea of equigenesis. Next slide, please. And we see this playing out as well. So that was our residential kind of proximity type variable. Here we're looking at people's own visits to nature. And again, we see this playing out. So this is data from Wales, using national survey data, looking at people's time spent on visits to outdoor natural environments. And again, we see this kind of possibility that perhaps spending more time visiting natural environments might help to narrow the well-being gap, in this case between groups that were classified as being in or out of material deprivation. Some real potential here that if this does play out, and I think the jury's still out a little bit on this. I think we've got lots of evidence that stacks up to support this, but I think there's lots of other stuff going on as well. But if indeed the equigenesis kind of hypothesis is playing out in real life, then there's a real opportunity for us here to capitalize on the benefits of natural environments, potentially to help narrow those health inequalities. Next slide, please. And then lastly, we have to look at this other area as well, and many of you will be familiar with these ideas as well, I think, around green gentrification, that what actually happens when we improve our living environments through, for example, urban greening programs or water quality improvements. This can potentially lead to gentrification of neighbourhoods. And obviously this has been going on for a very long time. You know, we see here the kind of a gentrification index for small areas of London. And perhaps unsurprisingly, some of the most gentrifying areas are those by the river. Now, if this was 150 years ago and the River Thames was still in quite a state, that gentrification at the riverside would almost certainly not be happening. So that water quality improvement really has helped to underpin the attractiveness of those riverside developments and gentrification. Next slide, please. So this has been explored in lots of different contexts. Colleagues in Spain have done lots of work on this, and they find in gentrifying neighbourhoods, only more privileged residents benefit from green space. So it's really difficult to tackle this because surely this kind of potential for green gentrification shouldn't mean that we just don't do anything, that we don't improve the environment just in case we end up gentrifying the neighbourhoods. Next slide, please. So I guess the key point of that is that amongst all of these things, we really need to consider how green and blue infrastructure situates amongst these wider drivers of population health, and consider how it aligns with the housing market and the employment market and all the other things going on in our neighbourhoods that might affect people's health and well-being, and ultimately how this all stacks up to impact on health inequalities. Next slide, please. So to summarise, differential access and exposure to nature, that inequality in opportunities to visit urban green space, inequalities in the distribution of the urban tree canopy, all different sorts of aspects of green and blue infrastructure are unequally distributed. Next point. In terms of equigenesis, though, the flip side, we might see disproportionate benefits for lower socioeconomic groups and potentially for other population groups. So potentially a real opportunity for us. And the last point, we have to be conscious that there might be adverse social impacts of environmental improvements. We need to understand what might happen, the sort of unintended consequences, I guess, of green and blue infrastructure interventions. Next slide. So this is where we get into this specific project that Julia mentioned at the outset. This is a project funded by the National Institutes for Health and Care Research. So how can planning and environmental interventions impact the green and blue infrastructure health inequality system. So really important for us to start getting into the detail of this. How can what we do to the environment actually be done in such a way so as to improve our situation in terms of health inequalities? Next slide. So this is the basics, I guess, of this project. So on the left in our green box, we've got all the stuff that we might do to the environment and our neighbourhoods and so on. So that comes through planning and environmental policy and interventions, social policies that are relevant. That has an impact on the green and blue infrastructure that surrounds us. And that in turn has an impact on population health. But we know that those actions could potentially drive inequalities in either direction. We've seen how these relationships are really quite complex. So depending on how we do this may serve to actually improve the situation in terms of inequalities, but could actually make them worse as well. So we really need to think about it. And we also know that there might be great co-benefits of these interventions, especially in terms of, say, climate resilience benefits or economic benefits and so on. And so if we only concern ourselves with the health impacts, then we're missing a trick here. And anybody who's familiar with the world of nature-based solutions will find this kind of familiar, this idea of understanding the multiple benefits of our environmental interventions. Next slide. So just a few examples from the local to the global that's actually going on here. What are we talking about? We're talking about things like small-scale interventions that might improve biodiversity in public parks. We're talking about citywide urban greening programs. We're talking about large-scale tree planting interventions. Next slide. We're also talking about the national policy frameworks and strategies this situates within. I'm sure many people here will have some involvement with or awareness of the Planning and Infrastructure Bill and the current planning reforms at Westminster that are going to be having significant impacts in the coming years, but also existing work, say like the Natural England Green Infrastructure Framework, work by Nature Scott, their green infrastructure strategic intervention that's been happening in the past. In Wales, the Wellbeing of Future Generations Act is really significant here in terms of really getting to grips with how are our environments and our populations interacting, how can we manage our environment in a way that's sustainable for the future of all of our generations. Next slide, please. And of course, that all sits in our global systems. For example, the Kunming-Montreal Global Biodiversity Framework that sets out how we want to be improving biodiversity globally and tackling the loss of biodiversity that's so huge. And the last ministerial conference on environmental and health, which is a WHO European region programme in conjunction with other UN agencies. For the first time, biodiversity is writ large in that declaration, and this really helps to set the tone for how we deal with environment and health, and making the point here that we need to think about biodiversity change, we need to think about climate change, we need to think about environmental pollution, how all these things link together. So we see action happening at all geographical scales. So like I say, the point of this project is to think about how can that action happen in the best kind of way to help us deal with health inequalities. Next slide, please. So that's where we're at. That's the kind of action we're looking at and thinking about these environmental and planning type policies and strategies. Next slide. And this is the nature of the project. So we're really just at the start. We're about a year into this project. We're on the left-hand side of this diagram at the moment, kind of building our theories, trying to understand the complexities of how these things are related to each other. And then in the next stages of the project, we'll be getting into the thick of this and carrying out empirical work that will be kind of UK-wide, but also some local case studies as well. So we're trying to build the evidence to inform action at local authority level. We've got great collaborators in Dorset Council, who we'll hear from shortly, Coventry City Council and Sandwell Council. Really keen to hear from others if you're interested, to bring you into the loop, and we can share some resources and so on. Also to hear about what evidence would actually be useful. We've still got about 4 years left on this project, so it'd be great to hear from you. But also working with our national organisations and colleagues here at TCPA, but also national government agencies and organisations as well. So that's the nature of the project. I'm just going to hand over to my colleague Mark for the last few minutes to give you an idea of the kind of stuff that we started doing at the front end of this project. Over to you, Mark. Thanks.
Hi everyone, as Ben said, I'm Mark. I'm a research fellow working on this project, and I'm going to talk through the theory building element of the project and just show you a snippet of where we have got to so far. So what we are developing is based on workshops that we carried out in the summer with professionals, public engagement groups, and academics who all had an interest and expertise in public health planning and/or environment sectors. Next slide, please. So what we've produced is called a causal loop diagram. You may have heard the term systems map used as well if you're familiar with the technique. And what we are trying to do is to understand the factors that influence population health and green-blue infrastructure and how health and environmental inequalities that Ben have talked about are produced within this system. So here's a really simplified version of this. The blue arrows here denote one factor increasing another factor, and the red arrows denote one factor decreasing another factor. So here we have green-blue infrastructure increasing or improving population health. And again, as Ben said, disadvantaged populations such as low socioeconomic groups have worse health on average. So we have a negative one going there from disadvantaged population characteristics to population health. And generally these groups tend to have less access to green-blue infrastructure and use them less. So that's another red arrow. So if you could imagine this arrow between low socioeconomic groups and green-blue infrastructure could be changed from red to blue, you could see how that would then have a knock-on effect on population health and potentially reducing health inequalities. Next slide, please. But of course, the system is much, much more complicated than that. There are tens, potentially hundreds of elements that could be within this. And we don't have time to show the whole system here, and it can be a bit confusing and overwhelming to show it. So rather than that, we're just going to focus on two elements that are relevant to planners. So here we have green-blue infrastructure quality and design. And we have green space access and availability. And this is one connection within our system that we have identified as impacting inequalities. So the idea here is if health and environmental inequalities are considered when designing green spaces or trying to improve the quality or the amenities in a space, this can be done in a way that considers and addresses existing inequalities, or it doesn't, and thereby it has the potential to worsen health and environmental inequalities in the process. Next slide, please. So again, just to show that it sits within this more complicated system, we can see here that there are other elements around these two factors that relate to them and they relate to others. So an example being investment in green-blue infrastructure or local level spatial planning policy, and they all have the potential to impact environmental inequalities in positive or negative ways and thus have impacts on health inequalities. So next slide, please. So the next steps for this part of the project is to go back to our workshop participants and our public involvement group and ask, does this make sense? What we've produced, what might it be useful for, and how might it be improved and importantly communicated? Because they, like I've said, they're complex systems. It can be quite big and difficult to communicate. And then these parts, the aspects of the system are going to be used to underpin the next phase of the research project. So we can do geographical data analysis, potentially looking at inequalities in green-blue infrastructure on some parts of the project, on some parts of the systems map, sorry, and then we can do sort of scenario modeling of on the impact of a change on health inequalities on potentially another part of the system. So next slide, please. So just to wrap things up, we know that if policies and interventions are done well, they can deliver on tackling inequalities in green, blue infrastructure and health. And in the rest of the project, we aim to produce evidence that should help to contribute to this. Next slide, please. So yeah, we look forward to your questions and comments, and we're happy to hear from anyone if you have any useful ideas about how we can make this evidence as useful as possible.
Thank you very much, Ben and Mark. That was a fantastic introduction, both to the subject of green and blue infrastructure and health inequalities, but also to the project that you're working on. And it's great to hear that you've still got a long time ahead of funded research to really dig into this and find out more. We are starting to get some questions in the Q&A box. We're going to take questions at the end, so please keep putting your questions in the Q&A box, and you're welcome to comment and say things in the chat, but we might not see any questions, so the questions do need to go in the Q&A box. So thank you very much. We're now going to hand over to our next speakers from Dorset Council, who are going to talk about a sort of practical application of this work and thinking. So I'm now going to hand over to Rupert Lloyd, who's the Senior Health Programme Advisor, and Amy Smith, who's the Local Nature Recovery Officer, both from Dorset Council. So welcome to you both, and over to you.
Brilliant, thanks Julia, and hello everyone, great to be here. I think Storm Benjamin is starting to affect my Wi-Fi, so if I drop out, I do apologise. But if we could go to the next slide, please. Great, thanks. Yeah, so I'm Rupert Lloyd, and I'm part of the Public Health and Prevention team at Dorset Council.
And I'm Amy, and I'm Local Nature Recovery Officer.
Okay, next slide, please. And yeah, what we're going to talk about today is some work we did to try to integrate access to nature for people, or consideration of access to nature for people, into the local nature recovery strategy for Dorset. And we'll say a little bit about our area, Dorset and BCP. We'll cover what we did and why we did it. And we'll say a little bit about how we think this can make a difference, and also leave you with some thoughts about what we could perhaps do differently or better. Next slide, please. So for those of you who don't know our area, when we talk about Dorset, we're actually talking about two different council areas down in the southwest of England. So we've got Dorset Council and BCP, Bournemouth, Christchurch and Poole Council. And the purpose of this slide is really to give you a bit of a flavour of the diversity of different natural, semi-natural spaces that we've got across the patch, and also how they vary both within the two local authority areas and between the two. So if you look at the left-hand side of the screen, you can see a bit of BCP, which is a conurbation of three quite distinct towns. And as you can hopefully tell from those images, BCP is largely urban. It's got lots of urban parks, gardens. There's very popular beaches, of course. There's golf courses, there's bits of heathlands and lots of other spaces or types of spaces that I won't mention now. But it's also got some quite wild areas. So at the western edge, there's Poole Harbour, and then over at the eastern edge of the conurbation, probably in the middle distance of that bottom left-hand picture, we've got Hengwesbury Head, which is also comparatively quite a wild natural area. And then in contrast, if you look at the three images on the right-hand side of the screen, Dorset Council, or DC, is much more rural. So there's market towns, lots of villages, places like Dorchester, Bridport, Sherborne, and all of those places, along with the coastal towns, Weymouth, Swanage, Lyme Regis, they all have their own urban parks and gardens. But we are in Dorset Council area, a rural area. There's large areas of what you could call open countryside where the public rights of way network, so the PROW network of footpaths and bridleways, is really important for enabling contact with green space, blue space, nature, as I'm sure it is, or as it is in lots of other areas of the UK. So to summarise the point that we're trying to make here is in Dorset and in BCP, we've got lots of accessible green, blue spaces, natural spaces, but like everywhere, thinking about, or like many places, thinking about what Ben and Mark have been talking about, those spaces and access to them isn't equally distributed for everyone. Next slide, please. So why is that important for us? Well, for us as a public health team, it's important for all of the reasons that Ben and Mark have just spoken about. But if I was going to try and wrap all of that up and massively oversimplify, for us as a public health team in Dorset, we think that access to nature, access to green space is important for health and well-being. It can help make people happier and healthier. And part of that for us means trying to address inequalities in access to green space. Next slide, please.
Thanks, Rupert. So I'm now just going to give a bit of an overview of Dorset Local Nature Recovery Strategy. So for those of you who don't know, local nature recovery strategies were a requirement of the Environment Act, and there are 48 being created across England, and there's a real emphasis on local people and organisations working together to agree priorities for nature recovery in the area, identify the different activities that different sectors can deliver, and also map where's already important for nature and where are there opportunities for recovery. We have the next slide, please. So here in Dorset, we had a real focus on communication and engagement right from the start, because we want this strategy to reflect the views of a real range of local people and organisations. So on the bottom right of the screen there is the kind of 6 key sectors or stakeholder areas that we identified: farmers, foresters, landowners and land managers, communities and individuals, business, industry and economy, public bodies, the nature and environment sector, and then those partnerships and connectors. So as you can see, that's kind of everyone. And we used that then to inform everything we did. So we formed a steering group, which on the bottom left of your screen are just the logos of the range of organisations there, from farming to community to the sort of more environmental organisations you would expect to see. And then we set up 5 advisory groups to work on specific parts of strategy development. But one of those was also communications and engagement, to ensure that we were just really doing that well from the start and trying to use a range of partners' channels to get messages out there and, importantly, get input back in to help us prepare the strategy. And we did that with a range of events, meetings, workshops, and then we had web pages. We also set up something called the Nature Recovery Dorset Network, where people can sign up to say what they're doing to make space for nature, and that's hopefully continuing to grow. And then for the actual strategy, we've completed a 12-week public consultation, and we're just in the process of finalising the strategy before it's published. If I could have the next slide, please. So here I just wanted to draw out how the local nature recovery strategy can link to the sorts of health and wellbeing co-benefits that we've been focused on today. So the statutory guidance is clear that we can't kind of focus on health and wellbeing or access to nature. However, we can look at how delivering nature recovery in particular ways will deliver those co-benefits for health and wellbeing. And here in Dorset, people really throughout the engagement across sectors were clear that they wanted the local nature recovery strategy to help that, having a healthy natural environment that supports our health, but having more nature-rich spaces for people to enjoy, more opportunities for people to connect with nature, and using nature-based solutions to achieve health benefits. And the image on the right there is our illustrated vision, and that tries to bring to life some of those of how delivering for nature recovery can also benefit people. And really, this is why we're really pleased to be able to join up with Rupert's work in the public health team, which I think I'm going to hand over to him to explain a bit more about now.
Great. Thanks, Amy. I did see your hand go up, Julia. Was that an accident, or did you want to come in?
That was an accident. Sorry, do go on.
No problem. Thanks. Okay, so yeah, this is our aim, what we set out to do, and I'll read that out. So what we were aiming to do was generate evidence of where LNRS nature recovery initiatives can address inequalities in access to nature. That was our kind of headline aim. We won't go into huge detail on the methods, but we were very lucky to have a GIS graduate called Joseph Doherty working with us on this project, and Joe did much of the hard work involved in what I'll cover in the next few slides. And as I'm talking, if you're a GIS expert, you'll probably quickly realize that I'm not a GIS expert, but if anyone has any techie or detailed questions about the methodology and what we did, then please do get in touch. I'll leave my email address at the end, and very happy to try and answer those questions in a bit more depth. Next slide, please. Okay, in very simple terms, what we set out to do was try to map access to nature across Dorset and BCP. And to do that, we had some tools at our disposal from previous work with Ben and Mark and other colleagues at the University of Exeter. So we had a database or a map of accessible green-blue spaces. So these are spaces in Dorset and BCP that are open to the public and are green in some way. So we didn't include private gardens in that, for example. And thinking about something Ben mentioned earlier, that database also didn't include what I'd call kind of incidental greenery. So street trees, for example, or other kind of green infrastructure features in the street. We had a walkable network of public highways, public rights of way, and informal footpaths. And what we did or tried to do was strip out sections of the highway, public highway network rather, sorry, which are less likely to be walkable. So sections of a road where there isn't a footpath or a pavement, for example. And then we previously tried to identify what we called accessible green paths. And those were sections of the public rights of way network that run through or are more likely to run through more natural areas. So not bits of bridleway, for example, that are in a really built up urban area. And I'll say a bit more about that in a couple of slides. Could we go to the next slide, please? So we had a few tools to help us, as I said, but we also had some questions that we needed to try and answer. So we had to consider which of the spaces in our green space database, our map, were more likely to provide contact with nature. And that could be because of what they contain, so the type of space they are, or their size, or a combination of the two. And if you look at those three images on the slide, they're all from Dorset Council area, so three quite different spaces. And I think if we look at them, we could probably all form our own views on which are more or less likely to provide contact with nature, and indeed which we are individually more likely to want to spend time in. And we probably also disagree amongst ourselves on both those points. But that was something we had to think about. Which of our spaces are more likely in Dorset to provide contact with nature? Next slide, please. And then we also had to think about the public right-of-way networks. So if you look at the screen, you can see two pictures, again in Dorset Council area, both of public rights-of-way. The image on the left, I think I was on my bike when I took that picture, so hopefully it's a bridleway. I'm pretty sure it is. And that's a bridleway that runs through an area of woodland north of Dorchester. The image on the right, believe it or not, is also a public right-of-way through an area of Dorchester, the town where I live, which is built up. And actually, if you look at it, you can see that at the moment, that path isn't usable at all because of building work. And this probably is a really obvious point to make, but the point here is in terms of providing access to nature, we knew that not all of our public rights of way were created equally, even if when you look at a map, they might have exactly the same symbology on an OS map, for example. And we had to try and think about which parts of the network, particularly in rural Dorset, were more likely to provide contact with nature. Next slide, please. Okay, Luckily for us, we were able to draw on work by Natural England and others in the Green Infrastructure Framework to help us try and answer these questions. And what we settled on was mapping a number of different access scenarios. And that's what you can see on the left-hand side of the screen. So we started off thinking about the kind of foundation, access to or distance to any green space in our database, then any nature-rich site that was 2 hectares or bigger, and then any green public right-of-way. Next slide, please. And this slide, this map gives you a flavour, a fleeting flavour of what we produced, which we called Nature Nearby, just for our own kind of shorthand. And what the map shows is lower super output areas, or LSOAs, and they've been colour-coded according to the percentage of the population that we estimated live within 300 metres walk of either a natural green-blue space that's 2 hectares or bigger, or a green public right-of-way. So one of those sections of public rights-of-way that is of a reasonable length, and we thought ran through a more natural area. Next slide, please.
Okay, now I'm just going to talk through how we then use the Nature Nearby data that Rupert's just been explaining within the local nature recovery strategy. So local nature recovery strategies are spatial, and they're required to have a local habitat map, which has 3 layers, which I've just talked through. The names that I'm referring to are the ones that we've given in Dorset. Lots of areas have given them other names. The kind of statutory names are at the bottom of the screen. So the first layer is nature areas of national importance. Those are things that are already designated for their nature value, things like SSSIs. And the second layer is the high opportunity nature areas. So this is where the strategy is proposing effort should be focused. And in Dorset, we used a sort of hybrid method. We've got proposals from land managers and projects, and we've also got some modelling of habitat networks and ecosystem services that have gone into building that layer. And the third layer is the potential activities, and that gives an indication of what activity might be the most appropriate thing to do in each of those areas. So that's an overview of what our local habitat map shows. If we could have the next slide, I would just explain how we then use the Nature Nearby data that Rupert described. So on the map on the screen there, in the lilac paler colour is the high opportunity nature areas. And then what we did was overlay the priority areas for creating nature nearby. So that's from the map that Rupert showed you, the areas where it's estimated 30% or less of the population have one of those nature-rich green spaces or right-of-ways within that walking distance from home. So those are bright pink on the map on the slide there at the moment. And so where those overlapped with our high opportunity nature areas, we then, on the next slide, we use that to inform the potential activities layer. And what this shows is that when you click on the map in one of those areas, one of the activities that come up, as well as maybe suggesting what habitat type might be suitable, it also says in the ecosystem service opportunity that there's an opportunity to reduce inequality in nature nearby. So that is drawing the 2 data sets together. If we can have the next slide, please. And just to sort of then explain how that will help hopefully deliver and increase nature nearby, the local habitat map is as part of the strategy, is a guide to a wide range of stakeholders to enhancing existing nature spaces and create new nature spaces across Dorset. So that might be across farmland, it might be small community projects or large community projects. And there's also some direct links to the planning system. So local nature recovery strategies are a new tool to help local planning authorities deliver on sustainable development and their existing requirements around biodiversity. So that map can be used as a guide to how to deliver those kind of nature recovery actions as part of sustainable development. So it will become part of the planning balance. It doesn't replace all the existing kind of policy and evidence, but it becomes part of that. So it can be a material consideration in planning, but it's important. It's not necessarily about preventing development. It's about kind of as an extra tool to inform that site design, so that the design is also delivering for people and nature. There's a link to the biodiversity net gain uplift, which if anyone has any questions, I might be able to explain a bit more. And there's also a requirement for local planning authorities to have regard to the local nature recovery strategy in their local plan development. So although it's one tool, it's not replacing the need for kind of the more detailed expertise and site-based assessments. Our hope is that by having combined some of the nature nearby data with our local nature recovery strategy maps, it will help identify these sorts of opportunities where nature recovery can be delivered in ways that is good for nature, but also will benefit people and the presence of nature nearby as part of development and plan making. And that we've also made some of the other layers part of the Nature Nearby project available so people can access more detail. And as I said earlier, the strategy is progressing to publication, and once that's published, we'll be fully into a delivery phase, so we'll be able to continue working with partners like Rupert and in planning and across all sectors to look at how we can kind of draw out those co-benefits more. Next slide, please.
Okay, thanks, Amy. So this is almost our last slide, and we thought we'd finish with a few thoughts about what we could do differently or better. So top one for me is something which is perhaps less about what we've done and what we could do in addition to what we've done, and this is about the community perspective, which is really key here for me. So a map obviously only tells you so much. It's only one piece of the jigsaw puzzle that can help understand access to nature, and the involvement of communities is, I'm stating the obvious here, but it's really key when you get to the point of doing any kind of intervention on the ground. It needs to be done in conjunction, co-designed with and through the people who actually live there. There's one for me to think about here about interpretation of the data. What we did and what it shows can be quite complicated, or is quite complicated. So as an example of that, we had some concern expressed by conservation organisations about areas identified as having lower access to nature near to, or perhaps encompassing, very sensitive habitats. And the concern there was whether we were proposing to provide or create public access that could potentially impact negatively on those habitats, and that's not what we're proposing. But clearly, there's a lesson for me in particular to learn about some of the supporting information with the mapping and the public consultation. Timescale, and this is, I'm sure, something that's familiar to lots of you, or would resonate with lots of you from lots of different projects. We ran the two projects in parallel. It would have been better, I think, if we had completed the work that we've been referring to as Nature Nearby at an earlier stage, so it could have been considered at the beginning, from the outset, I suppose, of the LNRS creation, because that would have given us more time, I think, particularly to socialise it with stakeholders and get more input on it from other members of the steering group, for example, or other key stakeholder groups for the NRS. And then finally, there's something here for me about future-proofing. There are other tools, other resources out there which are available for mapping or thinking about access to nature or green space, not least Natural England's access to green space standards mapping, which is readily available. And this is more of a, I suppose, a question for me, for us, is to think about how we make sure the work that we've done sits alongside that and is accessible to, for example, planners or perhaps community groups, but isn't confusing when viewed alongside some of those other resources that are out there. Okay, next slide, please. And that's it. Thanks. I think the only other thing we wanted to say is our email addresses are there, and please do get in touch if you've got any questions or want to know anything else after the session today. Thank you.
Thank you both very much indeed, Rupert and Amy. That's been really fascinating, and I think there's so much that we can all learn from that, and other places will, I should think, be very interested. I'm pleased to say we've had lots of chat on the chat, and I apologise that to begin with the chat wasn't working, but it is now, and it's great to see everybody sharing thoughts, ideas and contact details. We've also had questions on the Q&A, so we'll take those in a minute. But before we move on to that, I'd just like to point out the website for this project that Ben Wheeler is leading, and say that the recording of this webinar and the slides will be posted on this website. So this is where you'll find them. So we'll leave that up just for a second. But if I could ask the speakers to put their cameras on, I will then try and field some of these really interesting questions we've had. So thank you. If we could have the slide removed and then we can see everybody's faces. Brilliant. Thank you very much. So there's lots of questions. I just want to start off with a sort of general one for you all first, which is that the evidence that access to green infrastructure could help reduce health inequalities has been around for a while now, but it doesn't seem to be something that people are that aware of. Do you think there is growing awareness of it, or is it something that hasn't really been noticed? And Ben, perhaps I could put that to you first.
Yeah, sure. It's a great question. Thanks, Julia. I mean, I think my understanding of it is that it, like you say, these ideas have been around for a while now, and perhaps more broadly, just thinking about the connections between environments and inequalities has definitely been around for decades. But I suppose that awareness is probably, like lots of these things, in pockets. So there are places I'm aware of that have really taken action on this already, and perhaps other places that haven't. And there's so much that is tied up in that, I'm guessing, with certainly in terms of what goes on in local authorities, all the different pressures, certain things that will happen in certain places in terms of other priorities. So I think it's one of those ideas that is around, but perhaps very variable in its take up and its implementation. And rightly so, you know, so in some places there are other critical things that need to be sorted out. I guess the key thing for me for green and blue infrastructure is that it can end up being treated as a bit of a nice to have. And if it's a nice to have, that is a mechanism that's ripe for inequalities to develop.
Yes, absolutely. Thank you. Rupert, as you work in public health, I wonder, do you think among public health practitioners that I think over the last few years, the evidence that access to green space improves health is now widely accepted, but the idea that it could also help reduce health inequalities, do you think that's something that people are aware of, or not so much?
I think I definitely agree with the first bit of the question, the sort of general awareness about the benefits of green space nature for health and well-being. And this is a very unscientific question, sorry, but my kind of gut feeling, having worked in and around this area for some years now, is that has shifted from being something that was a little bit niche towards something which feels far more mainstream. And I think keeping an eye on the chat and the questions, and even who's asking those questions and who has come along to this webinar, perhaps gives a little bit of reinforcement to that. In terms of the potential for addressing inequalities, a short answer, I agree with Ben. I think there's pockets of understanding. I think there's more to do.
Yeah. I think it'll be very interesting when the new strategic authorities have their strategic plans, because they have a duty to have regard to reducing health inequalities. And there's a question about what they're actually going to do to address that. And linking with the local nature recovery strategy seems to provide opportunities there. Amy, I don't know if you have any thoughts about this, or would like to contribute, or Mark?
I think I'd probably just add that, well, yeah, or we can move on. All I was going to add is that it definitely came through all of our engagement, especially in the public consultation. There isn't a real awareness, but that's probably a lived experience awareness, as well as some of the evidence being known about.
Yeah, great, thank you. So there are lots and lots of questions, and some fascinating ones, and I'm not sure that you'll be able to answer them, but I'm just going to throw them out, and do just chip in if you'd like to have a go at answering them. There's quite a lot of questions about people's perceptions of green spaces and blue infrastructure as well. So there's a comment that some deprived communities who live by the seaside never go there because they just don't see it as something that they would do. There's comments about different ethnic groups. Research has shown that people's perceptions of whether a place is a nice place to visit, an interesting place to visit, whether a park is attractive or not, is quite culturally determined and varies between different groups. So access to green space isn't just a case of, is there a green space nearby? It's also about how you feel about it, which adds some really interesting complexity to all of that. I don't know whether any of you would like to comment on that at all. How, are you able to explore that in your research and your data?
I can chip in for starters, I guess. Yeah, absolutely right. And they're really, really good questions. And I think all the evidence that we've got so far really stacks up with, I think, what we would probably all feel intuitively, which is you need multiple things to be in place for that green and blue infrastructure to deliver on its potential. Not only good quality green and blue infrastructure in people's neighbourhoods, in the right kind of places, but also how that situates within wider feelings of community safety, of the kind of discrimination that people might feel whenever they go outdoors in public places, wherever that is. And I think some real tensions between what different kinds of people in different communities want from those particularly green and blue spaces. Some people want isolation and solitude, whereas for other people that's the last thing they want, and they actually want the social connection, and they feel much more comfortable in a space that's got lots of other people in it. And I think there's a comment in there about young people and teenagers. I think we often societally perceive groups of teenagers in public spaces as being problematic. And so how do we create spaces that support all different sections of community to enjoy them, but also obviously we have to kind of situate that within a much wider cultural and social kind of context as well.
Yes, absolutely. And certainly the TCPA's work on children, young people and local neighbourhoods has really highlighted that teenagers in particular don't feel welcome outside. Lots of complaints about them staying inside looking at screens, but when they go outside, they're not welcome in many places. So lots to unpick there. Rupert, would you like to come in on this?
Yeah, thanks, Gina. I was just thinking, taking a lot of what Ben was talking about down to a local or local authority level, I wonder if design codes, and I know TCPA have done work around design codes for health and well-being, perhaps is the tool at our disposal for thinking about how to engage different groups of people in thinking about what new green space, new public green space, new public multifunctional green infrastructure should look like for them.
Yeah, that's a really interesting point. Absolutely. And it's also interesting if you look back to the great Victorian public park designers, because they were dealing with a lot of very similar issues. And some of the really good public park designs include places to be tranquil, places to be active, very good sight lines if they're well maintained, so you can see other people and feel safe even if you're not up close with them. So I think to some extent we might be trying to rediscover things that have already been known, but we also live in a different society and that needs to be reflected too. There's a specific question about food growing and orchards, and we know that lots of communities are really interested in, actively taking over spaces, growing food. We think about the incredible edible movement, and lots of local activity starts with food growing. Is that something that you're able to disaggregate your data and really look into, or is it just a little bit too specific for your work?
I'll start. Mark might have better ideas than me about what we might actually be able to do, but I think it's a really great point, and you're right. Community food growing and so on is potentially really important. I think in this project, it might be quite challenging for us to get into because we're focusing our efforts on mostly big data, large scale data analyses and so on. But I know there are definitely projects going on that will be tackling those kinds of elements, and I guess maybe some of the stuff that we can do in this project is think about where might be the places that might benefit, or what might be the spatial distribution and so on. Mark, I don't know if you've had ideas on this.
Yeah, no, I think I agree with you. I mean, they did just get me thinking that, there is data on allotments and things like that. So I suppose, yeah, there is potential there, but I suppose it's about newer community spaces, is not the sort of part that we've focused on at the moment anyway.
Yeah, I think it's great that people are really asking you to go further and do more research and find out more. There's so much appetite for information about all of this.
Yeah.
Amy, I wonder if I could come to you next. There are a few questions about delivery of the local nature recovery strategy. So fantastic, you've done your mapping, you've got your spatial analysis, you've identified areas of opportunity. What's the next step to deliver those improved areas of green infrastructure?
Thank you. So, yeah, as I say, when I say well, hopefully the strategy will be published by the end of the year and we'll move into the delivery phase. That obviously will not be single-handed delivery of nature recovery across the county by the local authority. There's a huge range of stakeholders who'll be involved in that. But thinking probably just about, if we're thinking green and blue infrastructure, then some of the things I mentioned about linking into local plan development or possibly design codes, as Rupert mentioned, working with town and parish councils as well. There are opportunities there to kind of to make sure people know that the local nature recovery strategy is there, that these maps are available and how they can use them. Within that kind of more, that the strategy is quite high level, and then those more detailed proposals and plans and with additional evidence need to be worked up. So that's kind of the exciting next step, and seeing who will be involved. And some of that stuff is already underway, and this is just a new tool to enhance it and join it all up. And then we'll also be looking at how we can kind of monitor and measure what's happened, where actions been taken, and what that looks like across the county.
Great, thank you. And that, as somebody's pointed out, there are opportunities such as Section 106 and SIL. And I would guess also private sector investors who are trying to offset carbon, perhaps. There's some really interesting financial stuff going on in terms of bringing investment into green infrastructure. So I guess once you've got the strategy adopted, there will be a lot of opportunities. I hope so.
Yeah, absolutely. It's kind of all of those. It's not just one of those routes. It's going to end up being all of them.
There's a question again, I think probably for Rupert, about is there a correlation between the low super output areas with low nature access and poor health?
Oh, could you repeat the question for me, please, Julia?
Yes. So are the lower super output areas that have low access to nature, do they also tend to be places that have poor health?
Really good question. Thank you. We looked at it in terms of overall deprivation. So I suppose you could say you would expect more deprived areas to also have worse health. We expected to find that relationship, but we didn't find it, which is interesting. Because that's the picture that you would expect to see or do see nationally, but we didn't endorse it. Why that is, I don't know. Be interesting to get Ben and Mark's thoughts on that. I think part of it is probably to do with the coast and some of our kind of coastal communities, which tend to be our more deprived communities, but perhaps also have better access to public rights of way through natural spaces, or if you think of an area like Portland, accessible green space. That then leads me on to a question which we've already touched on today, which is physical proximity as a part of access is only part of the picture. We've also got to think about quality, what people want from that space, all of those other things that might influence how health giving, health promoting it is.
Really interesting. Mark, would you like to come in on that?
Yeah, thanks. I guess, yeah, it's a really interesting question, because I think this is the kind of the what you would expect to see a lot of the time sort of scenario based on the literature, but obviously context is very important, as Rupert said, and also the way we measure access to green space. So for example, the sort of green paths, if you incorporate those public rights of way through natural spaces, you can get a very different picture of what the accessibility of green space in relation to deprivation is, compared to if you don't incorporate things like that. So the kind of methodological decisions behind these sort of analyses can also have quite a big impact. So it's really important to be aware of those things as well.
Great, thank you. There's so much complexity in all of this, isn't there? So here's one that I think many people might be interested in. Beyond evaluating the overall quality, does the research identify specific features or attributes of green and blue spaces that support or enhance health and well-being? So if somebody's going to design a really healthy green space, what would it look like? Is there a universal answer? I think it might be the $100 million question. But anyway, Mark, is that a legacy hand, or are you keen to answer this one?
Legacy hand, sorry.
Okay, I might hand this over to Ben then.
Yeah, I can kick off. I think it is a really important question, and I think we have got some evidence now. I think, you know, I think 15 years ago, a lot of our research was really how much green space is there, or is it green or is it grey kind of thing, and it was a much simpler approach to the environment. I think everybody's recognised that all of these different characteristics are really important. You know, for example, benches, or, you know, public toilets, or opportunities to get a drink, or those types of things, as well as the natural features themselves in publicly accessible spaces. My hope is that with this research, we'll be able to build on that a bit and, you know, make use of all the data that's out there. I'm aware that other folks have used data like OpenStreetMap and things like that to really start being able to analyze data. It can be quite challenging, I think, to do the kind of research that we do. Folks have used things like Google Street View to try and get real sort of insights into what's actually there. So I think we'll do a bit of that, but we also recognize that what matters is different in different places, and this is going to be part of the challenge, I think, in that we're trying to do something that's inherently geographical and trying to come up with some of those ideas about, okay, what might be important characteristics to focus on. We probably already have a bit of an idea about that, but also how do we disentangle that a bit and think about what might be important for different people. And so even just that simple thing about proximity, I think there was a question about it in the Q&A about, you know, so for example, we might use 300 meters. That's really standard in lots of studies and standards and so on. But that 300 meters means different things for different people, and so we know that proximity for some people is absolutely critical, and maybe not even 300 meters, maybe kind of just across the street is where it needs to be. For other people, probably doesn't matter at all. They hop in their car and they drive off to wherever they want to go. That's fine. So I think just getting our minds around disentangling, you know, what are the characteristics, where is it, how does it matter differently for different population groups, is part of our challenge with this project.
Thank you. Unless anyone else wants to come in on that, I might just ask about, there's a question about, have you disaggregated the data by sex? We know that women and girls often find using public spaces a very different experience from men and boys. Sometimes it's because they're more scared of a space or the people in the space, or what might happen in the space. And sometimes it's just that the stuff that's provided isn't particularly interesting to them. So there's an increasing amount of qualitative and quantitative research about this. Are you disaggregating the data? Is this happening? And I think probably that's a question for all of you, really.
For us, yes, definitely. It'll be one of the key domains of inequality, I guess, that we look at. Again, you know, the kind of research that we're doing is quite big picture, kind of quantitative data. I think a lot of the richness for these kind of questions comes from that more qualitative type work. But I think it will be really important to us, and increasingly, I think people recognizing the importance of taking that intersectional approach to inequalities as well. We've actually just had a visiting researcher here for a few months working on, she has a particular focus on gender inequalities in access to nature and benefits from nature, but looking at that intersectionally, say between gender, ethnicity and socioeconomic status is increasingly important. So I think wherever we can, we'll be having that in mind.
Great. And I don't know whether Rupert or Amy, you have any comments about that?
Yeah, a quick one. I think the mapping that we've done, we have and can link that to lots of different other types of data, census data around disability, for example, or age. I think what I'm really interested in is perhaps taking that down to the other end of the telescope, and how do you then, for example, engage some of those groups of people, parts of the population, whether that's, for example, teenage girls, in thinking about the design of these spaces.
Yeah, absolutely. So as Ben said, lots of intersectional questions to be asked as well, and older people. And very important not to make assumptions about what people may or may not want at particular phases of life or particular people. Amy, would you like to come in on this?
A quick one that this conversation has sparked that there's an opportunity here for us to maybe next step to link with. There are some projects already happening in the county that do these sorts of things, but like linking up of how does the data we found link with what they're finding, and exactly that sort of join up. We can use it in different ways.
Great, thank you. There's one question here which I'm going to read out because I don't want to get it wrong, but it's about the intersection between the public rights of way and access. So it would be interesting to see the comparison of the benefits from accessibility to green-blue infrastructure. Oh, now the question's disappeared. So there I was reading it out and it's gone. And it was about the differences between those who are on a good public rights of way network and those who aren't. So I think I've now been slightly incoherent, but Rupert, I don't know if there's anything you can say about that. So clearly being located in a place that has a good public right of way network should make green infrastructure more available to people or more accessible. Whereas if you're in that awful picture that you showed with a building site and the path cut off, it shouldn't do. Is there any more you can say about the public rights of way work and access to green infrastructure? Sorry, I've been slightly incoherent there.
No, you haven't at all. I think it's a really interesting question, and there might be a few interesting questions behind that. So whoever's question it is, please do get in touch. I'm happy to have a chat about that. I think one thing I'd say is we had quite a lot of discussion about are we comparing apples with pears here, because rural Dorset, public rights of way, really important, and those public rights of way might run through green space of varying types of quality or naturalness, depending on how you define that. In an urban area, the surrounding environment is urban, is maybe less green, but what you might have access to is a really high quality urban park, which is designed in the way we've been talking about to meet lots of different people's different needs. But a footpath through the countryside is a footpath through the countryside, which may or may not be accessible, again, depending on, perhaps your mobility or lots of other different factors. But if we didn't account for the role of public rights of way in rural Dorset, we would have seen big swathes of blank on the map where access is shown as being very poor, which just doesn't chime with reality for lots of people who might live in a rural area and use a public right of way on a daily basis.
I think that's fascinating. And I know with our work in creating healthier places, it's often been focused on urban areas. And I will start thinking much more about public rights of way in rural areas. And there's a lot to be explored there, I think. We've had some fantastic questions. We haven't answered all of them. The speakers have kindly said if you'd like to email them your questions, they'd be happy to answer them. So please do. I'd be grateful if we could have the slide that has the project website address put up again so everyone can see it. Thank you. And so the slides and the recording of the webinar will go up there sometime in the near future. So do contact speakers directly. I'm going to put one last question to speakers. So if you could have a quick answer to it, because we're coming towards the end of the time we've got, I'd be grateful. So what is a good green space, or what is good green infrastructure? Ben, I'm going to go to you first. Give everybody else a moment to think.
Thanks, Julia. I'm going to start off with the classic scientist answer, which is it depends. But of course, that's completely meaningless, really. I think from all these discussions and all the evidence that we've got so far, it really is a matter of the right thing in the right place. But I think there is enough evidence now to suggest there are some key features that might be relatively universal. I think in terms of, well, providing places for quiet contemplation, as well as providing places for social interaction and social contact, providing spaces and places for people to be that feel welcoming, where they feel they belong. And obviously that fits into a much wider cultural social context as well. It's not just about the green and blue infrastructure itself. Provision for multiple uses, I suppose. So some people want to go for a run, some people want to sit on a picnic blanket. I guess safety as well is really important, not only that sort of social aspect of safety, but we haven't talked really very much about, there are potential risks of any time spent outdoors in any kind of environment. And so somewhere that is fundamentally a safe and good quality place to be. Yeah, so
right.
I mean,
I'm going to stop you there to give everybody else a chance, but that's a fantastic start.
Sure.
Particularly, it depends. So I'm going to turn to Rupert next. So fairly quickly, what is a good green space?
Oh, thanks, Julia. How do I follow that when Ben has been so comprehensive? So I'm going to, it's a cop-out, sorry, I'm going to go for my personal answer, which is a tranquil space that provides contact with nature.
Wonderful, nice and concise. Thank you very much. Mark, what would you like to add?
Yeah, I guess I would say thinking more in a urban setting is something that makes sense and is easy to use, and perhaps even you use it or access it without even thinking about it, because you're walking your dog on the way to work, etc. So it's integrated into your life without you having to do anything about it.
Great, thank you. And Amy?
I think we might have lost Amy, Julia.
I think we might have lost her. That's
I think broadband
awful.
issues.
Yes. Oh dear. Well, we won't know what Amy thinks. I am going to provide my brief answer, which is that there are quite a lot of frameworks which help think about this. So I'd give a shout out to the Green Flag Awards for Parks, which has a very simple framework about it being a welcoming place and responding to community needs. It's been going for 20 years. I think it's still got a lot to recommend it. There's also the Building with Nature standard about new developments, which is again based on lots of research and again has lots to recommend it. And Natural England's Green Infrastructure Standards Framework, which is a huge bit of work and provides a really useful way of thinking about what makes a good green space. So I'd recommend all of those. I'm really pleased to see Amy's with us again. If you have a moment, Amy, to answer the $1 million question, what is a good green space?
Apologies, technology let me down there. A good green space is one that's good for wildlife and for people, is the short answer.
Brilliant. That's a fantastic way to end. So I'd really like to thank all of our speakers for very rich and informative presentations. Clearly, a lot of work is being done and a lot more work is going to be done. So we will keep an eye on the project website, Ben, and look forward to hearing more about your research as it progresses over the next few years. I'd also like to thank our many people who've tuned in today and who've registered to watch the recording. So thank you for your interest. There's clearly a lot of interest in this subject, which is great to see. If you haven't joined the Green Infrastructure Partnership, do join it. You go to free newsletter and you can be kept in touch with all sorts of interesting things like this work. And thank you all very much. And we'll finish there. And while we're all on the call, it would be great if we could keep both the chat and the Q&A, if it's possible to save them. So thank you all. That's been absolutely great. And we will get the recordings over to you, Ben and Mark, and the slides. And I'm going to watch it again because I was too busy chairing to really take in all that information, but fascinating stuff. So thank you.
Thanks very much, Julia, and thanks everybody. That was great.
Thanks, Julia. Thanks, everyone.
Cheers. Thank you.
Thank
Bye-bye.
you.
Bye-bye.
Bye.